Hi, Dr. Jay Sordian. I would like to talk to you about the nutritional influences on estrogen metabolism. Estrogen is one of the hormones which regulates the cycles of women, and it's also a key component related to menopause. It is also something that is related to breast and uterine cancer. So it's very important to understand the metabolism, the different chemical pathways that are associated with this in order to understand why particular supplements are very important to help a woman be healthier and to avoid some of the cancer-producing byproducts in the body that we want to avoid, obviously. So there is a chart, this chart here, that I'm going to go through in detail for you to better understand the way that estrogen is metabolized or broken down and reconfigured in the body. All right? So, let's start out with section A. Section A here is looking at the production of sex hormones from cholesterol. Now, many people think, oh, cholesterol, terrible, terrible, terrible. Well, cholesterol is a very key component. It's the building block of many of the hormones in our body, such as estrogen, progesterone, testosterone, cortisol, etc. And so we have to have it, and our liver produces cholesterol. So let's look at a little more detail of this cycle. So this is a more detailed of the hormone pathways related to cholesterol. Up here, you see cholesterol. Next, we see that it changes into pregnenolone, eventually, and then it will convert over here into. So we have cholesterol here, pregnenolone, progesterone here, and then converting into other forms of hormones and eventually to aldosterone here. Progesterone, androstenedione into estrone and estradiol, shifting back and forth between these two forms of estrogen. There's many forms of estrogen, but estrone, estradiol, and estriol are three of the primary forms of estrogen. Estrone being E1, estrone 1, estradiol being E2, and estriol, and estriol being E3. You may see them referred to in that fashion. So the bottom line is we have cholesterol turns into pregnenolone, which then turns into progesterone, which then turns into testosterone, which eventually turns into estrogen, which is the E2 form here, estradiol, and the E3, E1 form, which is estrone. That is part A of this chart. A couple other notes in the A section as a review. This is the production of sex hormones from cholesterol. So as you can see from the chart, cholesterol is the basic building block for the production of estrogen, progesterone, androstenedione, estriol, which is E2, and estrone, which is E1. It can be noted also that DHEA, which comes from the adrenal function, can be a driving force producing the extra estrogen if a person is under chronic stress. And this is also producing excess cortisol levels from the adrenal glands, which puts more sugar into the bloodstream and creates a blood sugar imbalance. So key point here, sex hormones are produced from cholesterol, and stress can cause the production of more estrogen. So if someone has an estrogen, for example, if someone has an estrogen sensitive breast cancer, stress will cause more estrogen production and will cause a greater reactivity of those cancer cells.